first, live, local. This is Fox 12 Now.
Hello, everyone. This is Fox 12 Now. I'm Greg Nibbler. Thank you very much for joining us. We are live streaming simultaneously on our YouTube channel and also on the Fox 12 Oregon apps and at kptv.com. You can find all of our segments there afterward as well. We cover a wide range of things, but today we are talking about the nomination hearing for Robert F. Kennedy Jr. to potentially be the head of the Department of Health and Human Services. He is President Trump's nomination. The hearing was today. The Senate Finance Committee oversaw that, led by Ron Wyden from Oregon, of course, the Oregon Senator. And on this episode, what we're going to be doing here is we're going to actually hear from one of the nurses who was there. She did not testify, but she was there at the hearing, and that is Nurse Teri Mills. She is a former Oregon Nurse of the Year. She's part of Nurses for America, or a former leader of that organization, and a prominent advocate against the nomination of RFK Jr. So we're going to, during this segment, we're going to play some of RFK Jr.'s statements, including his opening statement. We're going to hear about some of his thoughts on vaccines and Medicaid, and we're also going to hear from Ron Wyden, both him and Ron Wyden talking together, and then Ron Wyden separately, and then we'll hear from Nurse Teri Mills. So there's a lot that's going to be going on here, but if you didn't watch all of the hearing, this will give you, I feel like, a little bit of the feeling as far as what went down and at least what some of the main statements were that were made. There's naturally lots more out there, but these are the things that we're going to focus on for this one right here. So let's go ahead and start this off. We'll play RFK Jr.'s opening statement. This is followed by a couple of other clips, so they all run together, so you'll notice a bit of a cut right there, but you'll see some of the things that he said. We'll come back, we'll regroup, and then we'll go on from there.
Thank you, Mr. Chairman. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today, and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he has more than just concern for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask, why are healthcare costs so high in the first place? In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high, the deductibles are too high, the networks are narrow, the best doctors will not accept it in the best hospitals. And particularly, Medicaid was originally designed for a target population, the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine.
All right, so again, hearing there from Robert F. Kennedy Jr., his opening statement, and some of the main things that he mentioned there throughout the day, some of the big themes being vaccines, who pays for medical services, et cetera. So we're going to be talking about that a little bit more here. Up next, we're going to take a quick break, but stay right here with us. It's about a 60-second break, so just letting you know that's going to be happening. But then we're going to hear from Senator Ron Wyden and RFK Jr. talking together. We'll hear from Senator Ron Wyden, and then later on we'll hear from an Oregon nurse who is an advocate against the nomination of RFK Jr. to be the head of the Department of Health and Human Services. So a quick 60-second or so break. We'll be right back with more. All right, thank you, everybody. Need to take a quick break there. Let's continue on talking about this. So we heard from RFK Jr. with his opening statements, some of those statements that he made. This next clip that you're going to see is a short one, but it demonstrates some of the contentiousness that was happening today. This is from Oregon Senator Ron Wyden, the leading Democrat on this committee, speaking to RFK about the vaccines, and in particular, they do reference an issue in Samoa where what the story is, that he was advocating against some vaccines that could have caused some measles outbreaks and other outbreaks there in Samoa. That's an entirely other story and topic to talk about, but that is something that's referenced in this and has been an extreme criticism of RFK Jr. So that's what Senator Wyden is referencing at the beginning of this. Let's go ahead and play that right now.
The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
All right, so there we go again, showing some of that back and forth that we heard today across the board on both sides of the aisle. Now, up next, we're going to hear from Oregon Senator Ron Wyden. This is his closing statement, and he does reference Oregon nurse Teri Mills, who we'll be hearing from later on. But we wanted to play this entire statement. This is, again, the senator from Oregon, Ron Wyden.
Committee this morning is whether Robert F. Kennedy should be trusted with the health and well-being of the American people. Committee staff have examined thousands of pages of statements, books, and podcast transcripts in a review of his record. The receipts show that Mr. Kennedy has embraced conspiracy theories, quacks, charlatans, especially when it comes to the safety and efficacy of vaccines. He has made it his life's work to sow doubt and discourage parents from getting their kids life-saving vaccines. It has been lucrative for him and put him on the verge of immense power. This is the profile of someone who chases money and influence wherever they lead, even if that may mean the tragic deaths of children and other vulnerable people. Now, Mr. Kennedy is fond of saying he's not making recommendations about whether parents should vaccinate their children. He's just asking questions and giving people choices. It's a slippery tactic to dodge any real responsibility for his words and actions. And it is, in my view, absurd coming from somebody who's trying to win confirmation for a job that is entirely about making recommendations. These recommendations are going to have life or death consequences for the American people. Mr. Kennedy, if you are confirmed, your recommendations determine which vaccines senior citizens get for free through Medicare. Your recommendation will determine which vaccines are given to millions of kids. Peddling these anti-vaccine conspiracy theories as our chief health officer is going to endanger the lives of kids and seniors across the nation. Just look at what happened when Mr. Kennedy inserted himself into an anti-vaccination crisis in the island nation of Samoa. He traveled there himself to push his views and pour fuel on the fire of a measles outbreak that began due to low vaccination rates. In the end, 83 Samoans died, mostly kids, from a disease that is easily preventable. Americans cannot afford to import this experiment to our great nation. On other healthcare matters, from abortion to universal healthcare, Mr. Kennedy has changed his views So often, it is nearly impossible to know where he stands on so many of the basic issues that impact Americans' daily lives. In a gobsmacking statement of irresponsibility, in November 2023, Mr. Kennedy said that he wanted to pause infectious disease research for 8 years. Mr. Kennedy has indicated he's open to restricting access to the abortion medication mifepristone, which remains a primary target of the Republican crusade against reproductive freedom. I took this on back in 1990 when I chaired the first congressional hearing on the topic. The science was clear then. It's even clearer today. Mifepristone is safe. The only reason it's under question in 2025 is because people with a political agenda have been out lying about it. Women deserve to know if Mr. Kennedy will abuse his power as our country's chief health officer to essentially implement a national abortion ban by restricting access to the safe and legal medication. Meanwhile, as the Trump budget office threw the Medicaid program into chaos yesterday, Republicans in Congress are proposing deep cuts to the program that will rip away health care from millions of Americans who count on this vital lifeline. Cuts to Medicaid of this magnitude are going to jack up the cost of health insurance. It'll shutter nursing homes and rural hospitals, deprive seniors and Americans with disabilities of home-based care. That approach amounts to handing over our nation's health system to for-profit insurance companies who've made a fortune delaying and denying care. Mr. Kennedy has virtually no knowledge or experience in handling these issues. It leaves him unprepared to take on a crisis like the nation witnessed yesterday when the Trump budget office shut down the federal Medicaid payment portal. After a careful review of Robert F. Kennedy Jr.'s statements, actions, and views, materials that I have reviewed personally and closely, I've reached the conclusion that he should not be entrusted with the health and well-being of the American people. When he's taken every side of every issue, how can this committee and the American people believe he has anything to say? Let me close by saying I believe more strongly than ever, and I have specialized in healthcare during my time in public service, that we're a turning point with regard to healthcare in America. If there's one word to describe Americans' feelings towards the healthcare system, it's disillusioned. At every single turn, people feel like they're rolling a load of dice, loaded dice, when they try to get healthcare. Americans are justifiably angry, fed up, and tired of a system that puts profits over patients. Instead of debating meaningful ways to improve Americans' health care, now the committee is being forced to relitigate settled science about vaccines and whether or not the federal government should help Americans get affordable health care. I know where Democrats on this Finance Committee stand when it comes to an agenda to lower costs and improve care. I must say, I cannot say the same about the nominee sitting in front of me. And let me acknowledge, finally, Mr. Chairman, Teri Mills from Portland, Oregon, who is here to represent Nurses for America, and I'd like to enter a statement from her organization into the record at this time. Thank you, Mr. Chairman.
With that.
All right, so that was, again, Senator Ron Wyden's statement, and he referenced Oregon nurse Teri Mills there at the end, and that is who we're going to be hearing from next. I spoke to Teri earlier today. She was in attendance at this hearing. She did not testify. That is not something that anybody does. It's actually just a hearing for RFK Jr., so you don't hear from the general public, but she was there. She's written a number of op-eds. So we're going to take another 60-second break, and then we will come back and we'll set this up and hear from Oregon nurse Teri Mills. right, we are back, and again, thank you for joining us. We are live streaming here from the Fox 12 Oregon desk. This is Fox 12 Now, our news desk from the newsroom here, and we're live. And we appreciate everybody who does join this show. So I want to get right to it, though. Earlier today, I spoke to the nurse that Senator Ron Wyden mentioned there, and that is Teri Mills. She's a former Nurse of the Year for Oregon. She worked for Nurses for America, a number of different organizations throughout the country, really, but also, of course, here in Oregon. So I spoke to her about her thoughts on this hearing, her thoughts about RFK Jr., and that's where we start off. So I'm going to go ahead and play that for you right now. Teri, thank you very much for being able to join us. Obviously, we were talking about RFK Jr. and the hearing for him to potentially take over the Department of Health and Human Services. And I think to start off, I would just love to hear your opinion about his nomination for this position.
Okay, well, first of all, thank you so much for having me. I really wanted to be here today because I've been a longtime nurse educator out in Oregon, in Portland, and I wanted to see if RFK Jr. met what we would say are the basic qualifications for nursing. And as you know, he's going to be leading the largest healthcare institution in our country, which are safety, integrity, and accountability. And that's the role of a nurse, is to make sure that we're advocating for patient safety and public health all the way. And so I wanted to hear what he had to say about those things.
And from what you heard from the hearing so far, what were your thoughts on his responses to some of the questions he was receiving?
Yeah, well, there's a lot of thoughts that I have. One is I'm really concerned about the fact that he's been a super spreader of misinformation about vaccines, and that was apparent today. And we do have a lot of documentation about that in his own words and transcripts that were presented before the committee members. And he did not take accountability at all for any of those statements. That's really alarming, because that's really scary if he's going to be the lead. And another thing that we heard over and over again is that he really wants President Trump's approval on every single thing he does. And I know in my nursing experience, if you don't listen to your team and those around you with the expertise and look at everybody's opinions, really, I've seen it happen where one person, if all you're listening to and you don't pick up what other people are noticing, you can really do harm to patients. And I'm afraid he's going to do harm to the whole entire public health arena. And another thing that I didn't hear as much of, but I wanted to hear, is I wanted to hear some of the research about vaccines. And I know from my readings and publications of my own op-eds and the research I've done, I've found some really strong research published, in fact, in The Lancet last spring, that showed that vaccines have saved the lives of 154 million people in the last 50 years. That's like saving the lives of half of the American public. That is very significant. And another thing I heard, like kind of skimmed over, but not as much, is that we really have a rise in the most common preventable communicable diseases. In fact, in Oregon right now, we're seeing more pertussis cases than we've seen in the last 50 years, and more measles cases than in the last 30 years. And I know that nurses are trusted because of the Gallup polls that are done. And I also had the opportunity and the privilege to be the medical lead for volunteering for our BIPOC clinics for the COVID vaccine in Washington County. And our patients trust nurses, and vaccines they work, they're effective. Yes, they have side effects. Side effects are expected, they're common, they go away very fast. Adverse effects are very, very rare, and we do educate the patients about them, but I didn't even see any of those, and I literally gave tens of thousands of vaccines during the time or assisted with them. So I really want to encourage your listening audience, if you haven't gotten your kids vaccinated, please do, because I talk to pediatricians all the time that are taking care of these kids that are sick with these diseases, and they're in the hospital. I mean, pertussis, whooping cough, it can be deadly to an infant. And measles can cause long-term complications like blindness and deafness. You don't want to see your kids suffer like that. So please get them vaccinated. So that's one, those were some of the thoughts. And, I have a lot of thoughts about some of the other things he said. Like one thing that he said that is just not true is that Americans prefer private insurance over the ACA. Well, remember when we did have private insurance and how what they did is they would not take patients with pre-existing conditions, which is a lot of us, right? Most of us have something that they could come up with and deny insurance. Another thing that it did is it provided coverage for prevention. Now, Robert F. Kennedy, one of the things that he said over and over again during the hearing is he wants to make Americans healthy again. That is his agenda. That is his platform. That is the reason President Trump nominated him. Heard it over and over again. Well, if that's really true, right now, right before the Supreme Court, they have agreed to take a case from Texas that removes the mandate that insurance companies are required to pay for prevention. Prevention is what we want to do for chronic conditions. If that's really the case, how come he hasn't said anything? Because actions speak louder than words. That's what my parents taught me.
When it comes to this particular hearing with him in there, is there anything positive that you saw from any of the statements that he made?
Well, yes. I mean, I do agree that we need to do more for chronic conditions, health conditions, and prevention. But some of the ways he wants to go about it just sounded like, like he was just reaching for straws. Like one of the things that people don't know is food is really not under as much HHS as it is with agriculture. For example, what he wants to do to the soil and what he wants to do for reducing harmful pesticides. Those are things that the Ag Committee handles, not his committee. So it's more like magical thinking than something that I think is realistic. Another thing is SNAP benefits. We don't want to see cuts to SNAP. We don't want to see breakfasts, free lunches and breakfasts for kids taken away. That's not going to help them learn. It's going to cause a lot of suffering among children. In fact, I think children are going to be the most hurt by his policies, and probably older people. And one other thing that I do want to say too is he is going to be in charge of Medicare and Medicaid. And if you look at Oregon, about 50% of our state population are covered by those programs. And one of his goals and Trump's goals, he wants to defund those programs. So we need to really protect those programs. We need to think about ways to enhance their effectiveness, not take away funding for them. That's not going to do anything. So on the whole, not a lot of positives. I mean, it's like I did hear what Caroline Kennedy had to say about her cousin, and he is very charismatic. He did have a lot of supporters in the room, but I felt like, again, that they're looking at information that's not based on science and fact. And just one last point, too, that I want to make is one of the things that really alarms me is how the Trump administration has frozen communication and science and travel and research among NIH and CDC. And we as healthcare providers depend on that communication so that we make smart decisions about what kind of care we're going to provide our patients, what kind of testing we need, how we boost up the supply of what we need in terms of medications, testing, and that is really going to be harmful. He did not talk about that. He does want to cut NIH and CDC funding for the next 8 years, and he also wants to cut 600 employees, but he wasn't able to say what employees or what departments those would come from. And that's a concern, like if you have a little kid who has cancer or you have an older adult parent who has Alzheimer's, we need to keep that research flowing.
I think my final question, just to, which you touched on, it seems like throughout this, but just to sum it up for this question, why do you think, for everybody watching at home, why do you think this hearing is so important for Americans in general?
Because everybody, you all have your life and your health. And my mom always said to me, Teri, if you don't have your health, you don't have anything. And he is going to be in charge again of an agency where he is supposed to be promoting and protecting Americans' health and advancing scientific research. He does not have the background, he does not have the experience, he doesn't have the qualifications. And with all of his past background and his statements, I think we need to be really afraid if he does become HHS Secretary. I'm very concerned.
All right, so there we go. That was Oregon nurse Teri Mills. And as you've seen, if you watched through the entire thing, we heard from RFK Jr. there at the beginning, heard his opening statement, some of his thoughts, some of the things that conflict with some of the ways that Teri Mills feels. We also heard from Senator Ron Wyden and a little bit of back and forth between the two of them throughout the length of this coverage. And this is Fox 12 Now. If you're just joining us for the first time, we cover a wide range of topics here on this show. We are live streaming here out of the Fox 12 Oregon newsroom from this desk every weekday starting around 1 p.m. And sometimes it's regular interviews that we have. Sometimes we cover segments, things happening. Sometimes it's what's happening nationally, but also how that relates to us here locally, like we just did here today. So thank you for joining us. Be sure to follow us on the Fox 12 Oregon app or download that app. You can go to kptv.com under the Fox 12 Now tab as well and take a look at the wide range, again, of topics that we cover on this show. But that's it for right now. Thanks for joining us. I'm Greg Nibbler. This is Fox 12 Now.